Uh, got it. OK. 大家好，各位长者、家人、朋友们，大家好。今天我们开始红叶健康医学讲座的第一讲，吞咽的风险与吞咽疾病的风险与呛咳。今天我们有幸请到了Susie Dolorenzo 来为我们做讲座。Susie 呢，她是注册的语言吞咽治疗师，她主要是在 Mississauga 的 Trillium 医院的中风中心工作，同时呢，她也在社区学校和养老院辅助有吞咽困难的老人。Susie 已经在这个吞咽治疗行业工作了25年，是非常有经验的注册医师。所以我们非常有幸请到了 Susie 来给我们做讲座。Good evening, everyone. Welcome to our first session of the Health Sciences series for Aging at Home. It's our pleasure to have Susie Dolorenzo to be our lecturer today. Susie is a registered speech language pathologist. She works mainly off the stroke center in Mississauga, the Trillium Hospital. And she also works in the communities, in schools and long-term homes through speech language, through Speech Solutions, which is her own company. It's our great pleasure to welcome Susie to start lecture. However, I would ask everyone to reserve your questions to the Q&A session at the end. And if you have questions during the lecture, you can write it in the chat box. 在讲座的最后，我们会留出时间来回答问题，所以大家如果有问题的话，就留在最后集体回答。如果想在中间问问题的话，可以在那个 chat box 里面写下来。Okay, now Susie, it's your time. Thank you very much.
Thank you. Thank you so much for the introduction. It's a pleasure to be here this evening and see some of you on the screen. I've been practicing for almost 26 years this fall, and primarily I'm working with patients in swallowing, specifically swallowing disorders. Many people often ask, why does a speech language pathologist have anything to do with swallowing disorders? And just briefly, it's because the same muscles that we use for chewing and swallowing are the muscles that we also use to communicate, to speak. So that
大家好，我叫 Susie，我在Trillium 医院工作，我在这个我是注册的语言吞咽治疗师，我大概到今年秋天我就已经在这个行业工作了26年。经常大家会问到，为什么吞咽与这个语言治疗师有什么关系呢？语言和吞咽又有什么关系呢？实际上，我们吞咽、咀嚼和语言用的是同一组肌肉。Okay, go ahead, please.
Okay, so of course this evening we're going to be talking about the swallowing disorders, but to start I wanted to review briefly the phases of swallowing. There happen to be 4 stages or phases, and you can have difficulties in one or more of these phases.
那我们在谈吞咽困难的之前呢，首先要谈一下正常的吞咽。正常的吞咽呢有4个阶段，在任何一个阶段，或者是在任何一个阶段都有可能发生吞咽困难的问题。Yeah.
The first phase is called the oral preparatory phase, and that starts with the anticipation of food being introduced into the mouth. Salivation is triggered by the sight and the smell of food.
第一个是这个饭团的在嘴里的准备阶段，这个就是你的大脑发出信号说准备 开始吃饭，那么就会有唾液分泌出来，就会有一些这个脑神经的信号开始。
Then the
Yeah.
second phase is the oral phase. The lips close and form a seal, and chewing of the food begins.
第二个就是口腔阶段，这个饭团开始往下走，那么呢，这个上面这个软腭呢就提高了，然后这个嘴呢就关上了，这个时候这个饭团开始往下走。OK。
Food then mixes with the saliva to form what we call the bolus. So that's the technical term, bolus. It's then transferred to the back of the mouth.
那么这个到嘴里的食物呢，和这个唾液会混合组觉，变成了这么一个团儿。他们术语叫 bolus， 实际就是我们就是一个食团，一个饭团儿。
Then we move into the pharyngeal phase. That's the third phase. That starts the swallow and squeezing of the food or the bolus down the throat. We need to close off the airway to keep the food or liquid out of the airway. Food going into the airway can cause coughing and choking.
那么从第二阶段呢到第三阶段，第三阶段就是进入了这个喉部阶段。大家看这个地方有一个小门儿，这一边呢就是食道，这一边呢就是气管儿，所以这个小门一定要能关上，才能让这个食品从食道往下走，而不是掉到这边的这个气管里边。所以这个喉头盖儿和这个气管的这个入口处，一定是要能关上，才可以让这个食品不掉到这个气管里。OK，yeah.
The last phase of the swallow is called the esophageal phase. This involves opening and closing of the esophagus. That's the tube that goes from the back of your throat to your stomach.
这第四个阶段呢，就进入了食道阶段。那么，如果你这个小门可以正常的关上的话，它通过了这个门，就把这个食品挤到了下面这个食道部分，然后就有一些波浪状的运动，这个食品就下去了。OK。
Okay, so now think of this a little as well. We all have problems swallowing sometimes. We've all felt, oh my dear, I've taken too much food into my mouth, or I take a quick sip of something and it feels like it goes the wrong way, and you start to cough and clear your throat. We all experience that once in a while.
他说呢，我们人人都会有偶尔的这个，好像觉得这个东西有点卡，或者是喝的东西有点卡，你需要那个清清嗓子，人人都会有这种状况的。OK。
Now, a person with a swallowing disorder will have trouble like this all the time. It happens very frequently, and that is what is called dysphagia. That's the technical term.
如果你只是偶尔的发生，那个就不是病态的。如果是你老是有这个发生，你老是有觉得东西在嗓子里，走得不干净，你老是喝一点东西就要咳，经常发生的时候，这个就是一个吞咽疾病，英文就叫 dysphagia。
So dysphagia really is any disturbance of the normal movement of food or liquid from that mouth to throat or esophagus.
那么呢，吞咽困难这种疾病呢，就是我们刚才说过的，在任何一个阶段都是经常性发生，是在嘴的这个阶段，还是在这个喉这个阶段，还是在这个食道这个阶段，经常都会发生咽不下去要咳出来的问题。
Dysphagia can affect oral intake, so that's how much we are eating. And of course, that affects our nutrition status. It can lead to dehydration, malnutrition, and of course, weight loss.
这个吞咽困难呢，可以影响到你食物进入的你能吃多少东西，以及你的营养状态，以及会脱水。如果要是这个吞咽困难，会造成你脱水，还有营养不良，以及失重，体重失重。
We worry a lot about this, particularly in older adults, because malnutrition increases the rate of infections, and that's because the immunity is also decreased.
对于长者来说呢，这个问题尤为严重。如果当你的营养不良的时候，你的免疫力就会低下。那么当你的免疫力低下的时候呢，你发生各种炎症的危险就会增高。
And lastly, dysphagia also increases the risk of aspiration and airway obstruction, which I will be talking a lot about this evening.
最后呢，也是最重要的，就是这个吞咽困难呢，会造成吸入性的阻碍，就是把东西吸到气管里了，这个是非常致命的。他今天也要主要谈一下这个呛咳的问题。Yeah.
Okay, this here I have 3 diagrams that you can see. This is basically what dysphagic swallow looks like. So there's before, if you can sort of take a look. Do you see my cursor when I move it around as well?
Yeah, we can see.
So here we can see that we have the bolus is what we're looking at here, the blue, and this is the airway. So that will go into the lungs, which is what we do not want. That is called aspiration, when food or fluids enter the lungs, happening before the swallow. This person hasn't even swallowed yet. In the second slide, this is during the swallow. So here you can see again, the blue is the food bolus. Some of it is going down this tube, that is the esophagus, which goes into the stomach. And then here again, into the airway, again, into the lungs. And then after the swallow has occurred, you can again have food or liquid going into the lungs, and again, sometimes into the stomach tube, the esophagus.
好，这个呢，就是当我们发生了吞咽障碍的时候，刚才讲到了哈，这是正常的，这个蓝色的是这个饭团儿，饭团儿就下来了。这个地方有那些个阀门，如果你的这个阀门没有关的话，这一边就是气管，这一边就是食道。所以当这个阀门关的不好的时候呢，这个喉结盖和那个声门关的不好的时候呢，一部分这个蓝的是食品就会掉到这个气管里，剩下一部分就会沿着食道往下。你看这个都是说有一部分掉到了气管里。Yeah.
Now, it's very important to learn what the signs and symptoms of dysphagia are. And I've really tried to be comprehensive in my list. Difficulty managing saliva, drooling.
You can, to save time, you do
Yeah,
3
I can go
or
through.
4, then
Sure.
translate. Yeah.
Absolutely. Slow eating, prolonged chewing, food residue, that's little bits and pieces in the mouth after eating.
OK， 那么对于这个吞咽障碍的人呢，有很多种症状，他尽量的把这些所有的症状都列在里面。你可能有一种，你也可能都有，也可能有几种。第一种呢，就是你这个唾液流哈喇子，第二种呢，就是吃的特别慢，嚼啊嚼啊嚼啊，吃的特别慢。然后第三种呢，就吃完了以后嘴里总还留点什么东西。Yeah, go ahead, please.
Throat clearing, that's or coughing during and after eating or drinking. Voice quality changes, that's when you sound almost like a gargly, wet voice. Nasal regurgitation refers to food or fluid that actually comes out and up through the nose because the nasal cavity is also connected.
这个还有一种呢，就是你吃完了还是喝完了以后呢，你就不停的要清嗓子。还有一种就是声音的变化，声音有一种像潮湿的那种声音，就是好像喉咙里面有痰。再下一种呢，就是有的时候你这个吃进去的东西呢，好像会往上反，有的甚至会反到那个鼻腔里面。
Spitting out of food is what expectoration refers to. So whether the person is actually spitting out food or fluid, even their saliva, they may be spitting. Difficulty initiating, that means starting the swallow, or people may often report that foods particularly solids, are feeling like they're sticking in the throat. Sometimes they feel that it's sticking up in the chest area as well.
刚才这个讲到这儿了哈，就是还有的时候呢，你就觉着有一些食品或者是饮品或者是唾液，好像都要往外喷。第二，还有一种呢，就是不能够开始吞咽，就是吞咽和吞咽的开始，你不能够开始吞咽。还有就是感觉嗓子里老是有一个什么东西在那儿扎着。
People may also feel pain when they're swallowing. They may become short of breath over the course of a meal when they're eating and drinking. They may just stop refusing. They don't want to eat or drink. And also the inability for people to feed themselves is also another symptom.
有的时候呢，他还有这个吞咽的时候有痛感，还有的时候是吃东西或喝东西的时候，就感觉是上气不接下气，喘不上气儿来。再往后就是拒绝吃东西，或者是拒绝喝水，最后就是不能够自己进食。
Okay. Now, I want to talk a little bit about the self-feeding, because a lot of the time when we are, taking a look at the elderly population or in a population of people that have illnesses, various different diseases, or have had neurological events such as strokes, they may not be able to self-feed. And I'm just going to review that a little bit here.
现在讲一下为什么有的人就是不能够自己进食。好，go ahead.
So they may not be able to feed themselves because they are weak or they're very tired. They don't have the energy to eat. And then, of course, because they're not eating, they will continue to not have the energy to eat. They may have some paralysis, so weakness. They may not be able to use their dominant hand, usually right-handed, but also, again, left. Decreased range of motion. So again, that's just using the upper extremities, unable to bring food into their own mouths. These are all some of the reasons.
首先呢，就是有可能这个人太虚弱了，他就没有劲儿吃饭。然后第二种呢，就是他的手抖，他就不能够很好的使用他的这个主要的时候，你是左手先还是右手先，就是手就不听使唤。另外呢，就是你这个手的这个动作就不能够把这个饭喂到自己的嘴里，就都哆嗦掉了。
People often may also have tremors or shaking. They may be stiff. They may be unable to bring the food to their mouths. There's a lot of spillage that can occur of drinking as well. They may have impaired memory. They may just not even remember how to eat or drink. That happens with impaired memory, confusion, and dementia. Just being unaware of food or fluid in the mouth, forgetting how to swallow. Unfortunately, in the end stages of dementia, that is very common.
有的时候就是还有这个手啊，就是都是非常僵硬的，肌肉都是非常僵硬的，这个东西就是送不到嘴里面，就都洒了。或者有的人呢，他已经出现了这个记忆的障碍，或者是老年失智症的早期，他就想不起来要吞咽，或者是他都没有意识到这个有食物要吞咽哈，这水要吞咽，然后去完成这项吞咽的这个工作。
Now, what we are most concerned about is called aspiration pneumonia. What that is the infection of the lungs.
那么现在最重要的就是要讨一下。
So aspiration pneumonia occurs when they have foreign
material.
material.
现在要讲一下吸入性肺炎。吸入性肺炎。
When we have food or fluids going into the lungs.
吸入性肺炎就是有这个异物落到了气管里。
And aspiration pneumonia is very common in long-term care homes, 13 to 40%. And unfortunately, it can be fatal. Now, Helen, your screen is frozen.
Yes, Helen's Wi-Fi is not stable. Maybe
Yeah.
Dave.
Okay, I can continue. I can cover up for her.
Yeah, Mary can continue. Thanks.
Okay.
Mary.
Thank you.
Okay, that's fine. 就是那个一男的那个网络有点问题，我就是支持他一下。就是说，那个根据这个研究表明呢，这种吸入性的肺炎呢，大概就是在这个老人院里面，占他们这种所有的感染这种病症里面占了13%到48%。
So it's important to be able to learn what the signs of aspiration pneumonia are. Chest congestion, a low-grade fever, it's usually at around 38.5 degrees Celsius, increase in coughing and change in sputum. So that is what the person is coughing up, and it could smell pretty bad as well. When you see this with any of your loved ones, it's very important to get them to the doctor or potentially the hospital very soon.
OK， 那个吸入性肺炎呢，有以下4个比较明显的一个症状。第一个呢，就是这个 OK。
Okay, sorry, Susie. You know, sometimes we have our internet is unstable. So can
No
you hear
problem.
me now? Okay. All right.
I hear you. Yes.
Yeah.
Yes.
Okay. So 吸入性肺炎呢，就是有东西掉到了这个气管里哈。这个吸入性肺炎呢，在所有这个 long-term home 就是养老院里面所有的感染里面占13%到48%，但是吸入性肺炎的死亡率是非常高的，是20%到50%。那么吸入性肺炎有什么症状呢？一个是胸口痛，一个是低度的发烧，基本上低于38.5度的发烧，然后就是咳嗽，最后呢就是口水，这个嘴里那个分泌物有非常不好的味道。当这个时候如果发生的时候，马上要把这个老人送到医院去。Okay, sorry. Go ahead, please.
Sure. Now, things to think about as well. Usually when someone has a dysphagia, swallowing, feeding difficulties, they're often related to specific diagnoses, such as neurological cases, people who've had strokes or head injuries.
这个吞咽困难呢，只是一个表象，它后面是有原因的，所以这个诊断也是非常重要的。比如说，第一个原因就是头部受伤，比如说头部中风，头部受伤，还是说脑神经出现了问题。
So any of the neurological conditions, Parkinson's, ALS, multiple sclerosis, surgical patients with tracheostomies, that's tubes in the throat to help them breathe, people with cancer, as well as, of course, people with dementia and other cognitive impairments.
有一些这个运动神经元的疾病，比如说这个多种硬化症啊，帕金森氏病啊，这个渐冻人病啊，这些人也会有这个问题。还有就是做过手术的病人，还有管的这个病人，或者是癌症患者，最后一个是老年痴呆症的患者。Okay.
When we think about dementia and dysphagia, there's numerous effects on eating and swallowing. So people often will have no interest in eating. They may have changes in the way that they perceive food. They can be very impulsive. They just don't have the awareness sensation in their mouth anymore. And that leads to delayed trigger of the swallow, forgetting how to swallow, and then, of course, malnutrition and dehydration.
老年失智症患者呢，在这个吞咽、进食和吞咽上呢，有很多问题。比如说，他失去了兴趣吃东西，有的时候呢，他就不知道这个食品是食品，就是他对这个问题、对这个事情，他就跟我们常人的理解就不一样了。他不认为食品是食品，有的时候呢，他就没有意识到自己的这个口腔的这个运动，还有，就是开始要吞咽的时候，他不能开始这个吞咽的这个动作，最后呢，就是开始以后他也忘记了吞咽，这样就会造成他 营养不良或者是失水。Yeah, go ahead, please.
Sure. So one of the things that we do as speech and language pathologists once we complete an assessment is make recommendations, and changing the diet texture, that's the texture of the food, is the key component in the treatment that we develop for dysphagia.
当你确诊了你有这个吞咽困难这个疾病以后呢，这个语言吞咽治疗师就会给你开出一个处方，让你改变你的食品的质地和你的饮品的质地。
So we can start by taking a look at the textures of foods. We have regular foods, which is what most of us are eating, soft, very soft foods, foods that are minced up like little bits. You can pretty much mash them. Strict minced foods include no bread or pasta, and then the lowest grade would be pureed. Think of foods that are put into a blender. Everything is completely pureed.
就是对于这个食品这一方面呢，就是我们有我们正常吃的这个质地哈，然后还有软的质地，然后还有这个切碎了的，就像打碎了那肉碎是那种小块块的质地，还有就是严格的切碎，就是不能有像面包啊，像我们中国人还有馒头啊，这个面条啊，西人就是意大利面条啊，这种东西都不可以。最后一种就是全部都是打碎的，我们叫糊状食物。
Mm-hmm. You know, when you think about people with swallowing difficulties, dysphagia, usually the foods that are pureed are the easiest to swallow because they don't have to chew, they can just swallow quickly.
对于这个有吞咽困难的人来说，这个糊状的食物是最容易吃的。Yeah.
Now, the thing that people don't realize is that liquids, just water, any thin liquid, moves very fast in your mouth and fast in the throat. And because of that, thin fluids are very risky. They can go into the lungs like this, very fast. So we often recommend thickened fluids. You can have fluids that are mildly thick, like a nectar. Think of like a tomato juice, mango juice, just a little bit thick. Moderately thick is like honey, and extremely thick is like a pudding. So there's a powder that you add to the liquids. You stir it in, and the speech pathologist would make the recommendation for one of these consistencies.
Excuse me, Susie. I think Helen's website internet has some issue.
No problem. No problem. Do you want to translate that?
Mary, would you like to back up?
I can hear
Okay.
people.
Oh, you can hear, but
Oh.
we can't. We don't see your movement, Helen.
Can you hear me now? No?
It's kind. Yes. Yes.
Can you hear me now?
Yes.
Yes, can hear
Can
you.
you now?
Yes.
Yeah, I don't know this whole thing. Sorry. 饮品呢？对于饮品说呢，大家认为饮品就是最容易的啦，比如喝水，水就是最容易下去的。但是实际上水是最危险的，因为这个水呢容易进到你的食道里，水也非常容易、非常快的掉到你的气管里。所以这个水有的人就喝不下去。它现在有3种浓度 ，Oh my God， 有3种浓度的这个水。第一种呢就是叫蜜汁型，就是像那个浓果汁的样子，叫 nectar shake thickness。第二种呢是蜜糖，像蜂蜜那么浓的。第3种是布丁，就是最浓的。它有一种瓶子里面装的这个加浓稠的一种粉末。如果你这个吞咽医师给你开了处方，不用处方，你就可以去买的。Did you hear all of this, people? Yeah.
Good.
Okay.
Yes.
Yeah. Go ahead, Susie.
Great.
I'm so sorry about my internet. I'm gonna complain to Kojiko.
I know what we do. Exactly. No
Okay.
problem. So a little bit just about, the diet textures again. You can see it's like regular foods versus very, softer foods, no raw fruit or vegetables. On the recommendations that the speech and language pathologist would make. And again, as I say, pureed food, here there's like a pureed vegetable, a pureed starch, and a pureed, meat or fish, poultry in there. That would typically be the safest. But all of these recommendations, of course, would come after an assessment. Then we have the liquid, same thing, just what we had talked about already, different consistencies. You can sort of see on a spoon what it may look like depending on the thickness. And that would make, again, the risk of food or liquid going in the lungs much less.
Sorry, Susie. Unstable internet.
That's okay. Do you want to try and take over?
Mary's there, and Mary, are you there?
Yes, I am. Can you hear me?
Yes, very well. Thank
Okay,
you.
I will follow up. OK， 那刚才现在讲到的就是说，为了对大家这个吞咽有帮助呢，减少这个危险呢，他们建议就是说，把这个液体的这些饮料也好呢，什么就把它的浓度加稠加粘稠，所以可以看得到现在屏幕上这个从水一直到最后的，就是说布丁这个状呢，就是越粘稠呢，其实对这个吞咽呢最大的帮助，把他们这个因为吞咽困难引起的一些危险降到最小的程度。Yes.
Right, good. Now, in addition to making changes to the food and the liquids that people are drinking, what is extremely important is feeding. So safe feeding or eating strategies is very, very important. These are a list of what I often recommend to my patients and their families. Is it best, Mary, if I go through one, or do you want me to do three and then you translate?
Maybe just do 3. That's fine.
Okay.
Yeah.
So promote a quiet, calm, and relaxed environment. Turn off the TV, reduce noise. The person must be fully alert. That's the most important thing. If a person is not fully alert, they cannot safely drink and eat.
好，那么就是说，针对这个吞咽有障碍的这个长者呢，其中呢有一个对他们最大的一个帮助的措施呢，就是说我们一定要帮助他们能够安全的进食。那么下面这些点呢，就是说确保安全进食的，就是他们从医疗的角度安全给的一些建议哈。那么第一条就是说，进食的时候呢，最好大家在一个比较安静的、平静的、放松的环境。第二条呢，就是说最好把电视关掉，然后呢也要减少这个外界的一些噪音。第三点呢，就是说这个吃饭的人呢，他一定要专注的，就是注意力集中的在那里吃或者是喝东西。
Now, make sure that the person is wearing their dentures, if they have dentures, their glasses, their hearing aids. Make sure they're seated fully upright when they're eating or drinking. We don't want them lying back. They need to be up straight. Encourage self-feeding or assist by using hand over hand. What that means, if I give you a demonstration, hand over hand, literally, as I take a piece of watermelon, if I was going to do this, you would be helping the person. They can assist with the fork or the spoon, and you can guide to their mouth. That is what you would be doing. Okay.
OK， 如果你要是
现在又回来了，我回来了。
Do you want to take
对不起
over?
大家，我今天不知道我这个网是怎么样。那我接着吧。刚才说到了那个饮品了哈。OK， 现在是安全进食。
第4条开始。
Starting from the fourth one, seat fully upright, right?
Yes.
No,
要坐
wear
直了，
denture.
是
Sorry,
喂
wear
食
denture.
吃东西的时候要坐直了。鼓励自己。wear dentures， 戴上你的那个假牙，如果你有假牙的话，戴上假牙。OK， Mary， you can continue。OK， 完。
第4点就是说，如果你是配了假牙的话，或者是你配了有眼镜，还有就是助听器的话呢，期望你进食的时候，这些辅助的这些设备你都要佩戴。然后下面一条就是说，不论是在吃或者是喝水的时候呢，一定要保持坐直的一个状态。还有一个就是希望能够鼓励就是这些长者能够自己来进食。如果他需要帮助的话呢，就是要手把手的，就是把他的这个食物呢，就是导向他正确的这个位置。
Now, if feeding is required, so if they cannot feed themselves, you must slowly feed using a small teaspoon. And cue for swallowing after each teaspoon. So you would cue them, you would say swallow, you may gently touch their throat. That can help them as well.
如果要是需要喂食的话呢，就是说要用这个小的勺、小的匙羹，然后缓慢的喂他们。同时呢，喂了以后呢，一定要给他做一个手势，就告诉他，你现在每喂完一勺，就跟他说，哦，你可以开始吞了，就给他这样一个指引。
And it's very important that you always watch for the swallow before you give the next teaspoon. Remain, also very important, after the meals, remain sitting up. You don't have to sit up all the way, but at least sitting back a little, not lying down, for at least 30 minutes after a meal.
然后就是说，一定要等他把，就是说前面的一勺的食物完全的咽下去以后，再喂第2勺。还有一个就是说，如果吃完饭了以后呢，一定让他保持这个坐姿，当然不一定说坐的那么直了，但是至少不要躺下去，至少要保持这样的坐姿了，大概30分钟。
Okay. Now,
you want to take over, Helen?
I apologize. Sorry, Susie. Yeah.
Oh, no,
Okay.
it's okay. It's out of your control. Oh, I understand.
Yeah. Okay.
Now, here, I just put in sort of a picture so that people can visualize. When you are eating and drinking, this is the safe positioning. So we recommend that 90 degrees from a seating plane. Usually, we just have the head straight or slight chin down, slight chin tuck. And that will help significantly to help control the bolus, that's the food, protection of the airway, that's the trachea. We don't want to have abnormal body movements. And also this will help for them to self-feed as much as possible. Good?
Helen, we can hear you. Helen. Sorry, it's Barry there. Are you there?
Yes, I am. Okay.
There all the time.
I will try my best, Susie, because some of the terminology I'm not quite familiar. So
Right.
Anyway.
That's okay. Keep it simple. You know what? Keep
Yeah.
it simple. Just explain how important it is to make sure that they're sitting fully up.
Yeah， 就是说大家在进食和喝饮料的时候，它这里有个图片比较直接啊，大家可以看得到。基本上就是意思就是说你一定要坐直，然后呢就是你的那个下颚呢就是往下稍微往下这样子低一点，不要仰着这种。那么基本上就是，然后就是说你的这个身体也是，就是肚子啊这些都是比较直的这种状态。然后呢，最好的就是说保证自己就是方便自己能够自主进食这样子。
One of the things, mentioned this here, you see how this is the knees. If somebody is at home and they are always in their bed, you know, we have many people living in their homes and they have bed, they do not get out of bed anymore because they are elderly, they're not able to walk. It's important to put a pillow under their knees, unless they have a hospital bed that they rent or own, you know, you can raise the knees up. But if not, putting a pillow under the knees is going to help position them safely when they're eating and drinking.
OK， 那么这里呢，我们重点的讲一下，就是说，如果有一些老人他是长期卧床的哈，那么他身体不行啊，不能够移动什么的，那他可能是坐在床上吃东西。那么在这种情况下呢，除非你是有一种就是医用的专用的那种床呢，它那种床是可以做出一些就是说做出一些形状，然后让你的脚可以弯曲。否则的话呢，他建议你们呢，就是说在他喂食的时候，如果他坐在床上的话，在他的那个脚就是膝盖那个部分呢，下面加进去一个枕头，就把这个脚稍微把它架高腾空一点点。
Okay. Now, if somebody is in a wheelchair and they're eating their meals in a wheelchair, again, we want to make sure that they're following as best as possible. We want the pelvis here to be as far back in the seat. That will help keep the body in the middle, arms and legs to be supported whenever possible as well.
那么如果这个长者他是坐在这样的一个轮椅上进食的话呢，就记住就是说他的这个后尾骨啊，他的这个一定要完全的贴到这个轮椅的最顶端，就尽量往后坐，然后同时呢他的那个脚呢一定要撑在那个脚托上，这样子的一个姿势。
You may need to put a small pillow in the back of the chair to help position people better as well. Again, remember forward is okay, never back.
那么在这个时候还有一个建议，就是说可以在他的后背这个地方呢加一个枕头来支持他，就是记住呢，就是说总的来讲呢，稍微身体往前倾一点，好过那个整个人是往后仰的这种姿势。
Okay. Now, after finishing the meal, I was saying it's important to sit up at least for that 30 minutes. So 60-degree angle, so that's just slightly back, is okay. Just never lie down. That is very important. We do not want to have reflux. That can mean that the food or liquid can actually come up and it can go into the lungs as well, be aspirated. This reduces the esophageal compression. So that's one of the main reasons that we want to make sure sitting up so that there's not food coming back up. Okay?
那么就是说记住，刚才大家那个苏子医生也讲过，就是说吃完饭以后呢，最好是要能够保持这个坐姿，保持30分钟。那么它这里有个图，大家可以看得到，就是说你不一定要做成90度，但是至少你要保证一个大概是60度的这种坐姿。主要的原因就是防止这个食物反过来反胃反上来了以后呢，就很容易又重新进到我们的肺部，就会有危险。
Okay. Now, what can we do to assist, to help people with feeding? So if somebody is holding food, we call that pocketing or holding the food in their mouth. One of the things, I've listed a few, is feed only 1 teaspoon per swallow. Watch the Adam's apple move up during the swallow. Give the verbal cue, chew, swallow, you're telling them. You can also press light on the lower lip with a spoon, just lightly, or even under the chin with your hand, and that can start to get them to eat.
那么有的时候我们会注意到有一些长者他在吃饭的时候，他容易把那个食物含在嘴里面，他就不嚼或者不吞。那么这个时候我们要注意，就是说这种情况我们一定要一口一口的喂，也就是说他这个喉结上下移动，你看得到他吞下去了，你再去喂下一口，而且呢你要给他口头要说，你要嚼，你要吞，就给他一些指引，告诉他怎么做。还有一个就是说，你轻轻的，就是说摁住他的这个下嘴唇，或者是呢，用你的勺子呢，就是说顶一下他的这个下颚这个地方，用你的手顶一下他的下颚这个地方，这样的话就提醒他开始咀嚼。
Now, a person may also be holding the food in their mouth for a long time. One thing you can do is take a spoon that's empty, no food on it, and you gently push down on their tongue at the front of their mouth. That can sometimes help to get them to trigger the swallow.
还有一种情况就是说，他就是含着，他不咽，你怎么说他都不往下咽。这个时候呢，可以尝试呢，就是说拿一个空的勺子，然后很 很轻的，就是说放在他的嘴里呢，然后轻轻的压一下他的这个舌头，提醒他要开始咀嚼吞咽。
Okay. Now you can also demonstrate. You show them, right? Exaggerate the chewing, the movements. That can help to remind them what they need to be doing with the food to swallow.
然后还有一种方式就是就像对小孩似的，就是用一些比较夸张的方式去演示，去动作，告诉他你要吞、吃、吞咽，就是做一些这种动作，然后提醒他，帮助他。
Okay. And now remember, if the person is not alert, try back later, because if they are not fully alert and awake, they cannot safely swallow. If meal times are long, which means more than 30 minutes, then it's sometimes best to break down the meals. Instead of having breakfast, lunch, and dinner, you can have smaller meals throughout the day. So this way they're eating just as much, but smaller amounts.
那么还有的时候，如果这个长者他就是说，身体也不舒服，或者说不是很清醒，不是很注意力集中的话呢，就可以迟一点再喂他。但是还有一种情况就是说，如果每一餐你喂食的时间太长的话，超过30分钟的话，你不如呢就把这每日3餐呢把它分解成几个小的，更多一点，但是每一次喂的时间不用那么长。
Now, I just wanted to mention as well.
Mary， 我回来了。
OK，
OK， 谢谢你。
没事没事。
What I wanted to mention is the importance of oral care. This is critical for keeping the bacteria low, because when oral bacteria is brought into the lungs with food or liquid that is being aspirated, then the risk of developing a pneumonia is increased significantly. So that poor hygiene, the oral hygiene, increases the level of oral bacteria in the mouth. So I'm going to talk a little bit about that.
那么现在讲一下这个口腔卫生，为什么口腔卫生对于吸入性肺炎是这么重要的？如果口腔卫生不好的话呢，很多细菌就会随着这个东西一块儿掉到这个肺里去，那么肺发炎的机会就非常高。Yeah, go ahead, please.
Okay. Now, oral hygiene recommendations. So what I always recommend is after every meal, you must complete oral hygiene. You can use a toothbrush with a small head and soft bristles. Usually I recommend something that this type of toothbrush is ideal, where there's a soft end as well. It's usually like a silicone type, just basically good kind of rubberized grip. Make sure the person is sitting fully upright again, just like that when they were eating. The head can be tilted to one side or down. And you can have like a large basin. Sometimes people use like a big bowl, very large bowl, a container, so that they can catch the residue as things are coming down from their mouth. But essentially, talking to the person about what you're doing as you're completing the oral care is important. I always recommend you want to massage the cheek area, massage the TMJ area. This is the joint that's going to help to relax the muscles. It will help encourage them to open their mouth as well. To keep the person's mouth open safely during the oral care, you can actually use, we call it the 2 toothbrushes. So you have one toothbrush that you actually put into the mouth like this at the side. What happens often, people will have a bite reflex. And so what we want is that toothbrush, it will hold the mouth open. And then you're brushing their teeth with the other toothbrush. Okay.
这个口腔卫生就是每一次吃饭，每一次进食以后都要刷牙。当然，如果长者们自己还能的话呢，就是自己刷。如果有的已经不可以的话，家人每一次吃饭以后都要帮助他刷牙，要做成那个90度，就跟刚才那个进食那个位置差不多，要做成90度。也可以把那个头向一边 侧一下，然后他建议用这种牙刷，就是前面有这个毛比较软，后面拿的这个把呢又比较宽的这种。如果老人有困难跟你配合的话，他还教了一个小秘方，就是你用2个牙刷，一个牙刷把那个牙支上，另外一个牙刷去来刷，然后要拿一个大一点的盆儿或者是容器哈，接着这些流出来吐出来的东西。它总的来说就是每一次吃完以后都要进行口腔卫生这个步骤。Yeah, go ahead, please.
Okay. And one thing I forgot to mention is one of the things that you really should purchase is a low foam toothpaste. If you go to any of the stores, good pharmacies, if you ask for a low foaming toothpaste, that will be best as well, because you do not want a lot of foam in their mouths. They will have a hard time managing that.
然后他想提醒大家哈，就是你不要用这个正常的牙膏。如果你到这个商店里去问，他有那个低泡沫的牙膏。如果这个老人自己进行口腔卫生已经有问题，需要你帮助的话呢，你可以买这个低泡沫的这种牙膏。Okay.
Okay. Now, I know one of the things that people often ask is, what do I do if someone is choking? So the very first thing is difficult, because again, I know it can be very difficult to tell, especially if someone is older and if they are confused, they have dementia. So if they're coughing during the meal, they are actually choking, it's a common reflex of aging that happens. So if they're choking, they usually will not be able to talk at all. They won't be able to breathe. They may start, motioning to their throat. If you start to see their skin changing color, absolutely, it's time to call 911. Very first thing, not 111.
如果发生了这个呛咳怎么办呢？你一般的长者这个呛咳以后呢，他就已经不能够喘气儿，也不能够说话，所以一般他都会用手势来向你表示他呛咳了，然后他的脸就会变成紫色、蓝色，就是非常这种一般发生都是非常短时间的。那这种情况发生的时候，第一件事就是马上要急救，第一件事就要打911。Yeah, 911, okay.
Yeah, that's the most important thing. Now, the other points here, there's black blows, there are Heimlich maneuver. I'm going to show a very brief video, but this is important because I'm going to share my screen here again. Okay, can you still see my screen now?
Yeah, I
Okay.
can.
Okay, so I'm going to press play and unmute.
Somebody's choking. First, I'm going to ask them, are you choking? And if I'm not, she can't speak to me. She can't make any sounds. That means I've got to do something. I've got to get
Can
it
you
out.
guys 你们能看到这个录像吗？
No,
No,
we can't.
Susie can't see the video.
Oh, you
但
cannot see the video?
Yeah, cannot.
Oh,
Maybe we share again. So 他
interesting.
现在就是说，如果这个呛咳发生了，有一个叫哈姆立克急救法，
Okay.
他就想给我们放一小段视频，演示一下怎么样急救。那再
Okay.
试一下哈，这个视频没有上来。
I'm going to select share screen again. So let me select here, share screen. Okay, there we go. I think you can see that
Yeah,
now.
now it's happy. Yeah. 现在就是如果发生呛咳了怎么办？这个叫哈姆立克急救。
Somebody's choking. First, I'm going to ask them, are you choking? And if I'm not, she can't speak to me. She can't make any sounds. That means I've got to do something. I've got to get it out. Now, the technique I'm going to show you here is called abdominal thrust. You probably know it as the Heimlich maneuver. So what I'm doing is I'm getting behind her. I'm finding her hips and I'm coming. That's my marker where my hands are going to go.
Okay. Do you want to just tell them right now about the hips?
Yeah. 第一，首先是这个人已经不能说话了，然后呢，他就会向你比划，他呛了。那么首先你要站在他后面，你要找着他的腰这个位置。Yeah.
Right across from her hips to right here with a fist. I'm around her belly button, maybe a little bit above it. Other hand is on top of this fist. And now I'm ready to pull in and up, which we'll show you. I'm going to move you this way. Once I'm here, this is the part we can't practice. I'd start going in and up. It's kind of a scoop motion. What I'm trying to do is get into her belly and then take all the air that's in here and bring it up, right up through the trachea to dislodge the object.
好，那么现在这个如果长者有孩子在跟一起，这是非常重要的。你首先在他后头，你找着他腰那个位置，然后你就
胃里的东西往上，就是让他把那反出来。
把那个一个手，是把一个手呢放过去以后，要放在他的这个肚脐儿的上边这个位置，然后另外一个手呢再过来，两个手交接，第一次过去那个手要做成一个拳头的样子，放在肚脐儿的上面，然后另外一只手过去找到这个拳头这个手，它是为了让你往里抽的时候能把这个东西给那个反上来。Yeah, go ahead, please.
This is very effective. It's really common within just 1 or 2 or 3 of these thrusts, the object will come flying right out. So in this technique, this is called a back blow. It's taught by the American Red Cross and a lot of other countries. This is the primary response to a conscious person choking.
So this is back blows. It's both Heimlich and back. Okay.
第一种叫 Heimlich， 是把那个东西给弄上来，然后你就会发现它从那个嘴里给喷出来。这是第二种办法，是往后。OK。
In this one, what I'm going to do, it's a blow with my heel. I'm going to move you here, right here between our shoulder blades. It's up high. The object is right on the other side of my hand. So I'm going to do a hard focused blow to get it out. It's basically, this was Gulia's back, right here. Now, an important.
Okay.
好，现在这第二种办法就是要拍他的这个脖子后面这个地方哈，这个在肩和脖子这个交界这个地方要拍。
So what we do is 5 Heimlich and 5 back.
所以他就说，你做5下哈姆立克，就前面肚子那个哐哐哐哐往上弄5下，然后再扭过来快后边5下，就是5加5， 5加5，直到你把这个东西拍出来。
Okay, good. So I will go back to my just so you could see a little bit of that is helpful. Okay, so I will go back to my screen. Okay. Here we go. Share my screen. Can I see? Oops. Hold on. Share screen. There we go. Tell me once you can see that again.
Yeah.
It's there.
It's back, yeah.
It's back. Okay, so here, current slide. Okay, so ultimately, what can we do to reduce the aspiration and airway obstruction? That's what the goals are. So number 1 is the food textures. If you change them to the different consistencies, that helps to improve swallowing. We have to follow the safe feeding recommendations and follow oral hygiene. That's the brushing of the teeth, keeping the mouth clean. But
那我
also,
们如何减少这个风险呢？第一就是刚才讲过了，这个食品和饮品。其实当你出现了这个吞咽困难的时候，就是需要重新看一下自己是不是还能吃这个质地的食品，是不是还能喝这个厚度的饮料，可能是需要改变了。然后如果需要喂食的老人呢，要 follow 要按照那个刚才那个正确喂食的那些个角度，喂的时候多少，喂完了多少那个角度。第3个就是一定要注意这个口腔卫生，控制这个细菌和这个感染的风险。Yeah, go ahead, please.
yeah, so obtaining a referral for a swallowing assessment by a speech and language pathologist can be done from your family doctor, and they will make the referral through home and community care support services.
就是如果你发现家里有人，刚才讲过这么多的症状，你觉得这个家里这个人可能是有吞咽障碍，你就通过找你的家庭医生，要求这个语言吞咽师来给你做一个评估。有的时候他是可以来家里做的，或者是你就是你的家庭医生可以通过原来叫 link， Lean 后来叫 CCEC， 现在叫 HCCSS， 就是社区家庭与社区保健服务这么一个机构，你的家庭医生就可以通过那个地方要求一个语言评估师到家里来给你做一个评估，然后通过这个评估才可以告诉你现在需要在食品上改变什么，饮品上改变什么，不要自己改哦，要经过评估以后才能改。OK。
Okay. And at the very end, oops, the last thing I want to just say is, what is it that you have to look for? So these are the things. If you are seeing any of these things or a combination, please request the family physician to make a request for the swallowing assessment. So difficulty managing the saliva or drooling, the slow eating, the slow chewing, food left in the mouth after eating.
就是你什么时候就要去寻求评估呢？找你的家庭医生说，我可能开始有这个吞咽的问题了。就是第一个就是你这个嘴里这唾液，有的时候会有哈喇喇子哈，然后就是吃的时候呢，吃的很慢，嚼咀嚼的那个时间也非常长，然后就吃完了吃东西的时候呢，总是觉得有些东西落在嘴里了。
Throat clearing or coughing during the meal or after the meal or drinking. The voice changes if they sound wet, it's like a gargle, nasal regurgitation, so food or fluid coming through the nose.
如果是说吃东西老要清嗓子，喝一个东西老要咳一咳，然后嗓子的声音变了，好像有一点嘶哑，还有的时候有的东西会往这个鼻腔里面反。
If they are spitting out their food, the liquids, or their saliva, if they're having difficulty starting that swallow or complaining of solids sticking in their throat or pain when they swallow.
如果有的时候东西还往外喷，唾液也往外喷，甚至或者是说不能够开始吞咽这个动作，或者是觉得嗓子里有什么东西在那儿顶着卡着。
Okay. And if they become short of breath, so, over the course of the meal, if you start to see, oh, their breathing is changing, if they are not able to feed themselves, or if they are refusing to eat and drink, they're losing weight. These are all reasons to ask for an assessment.
就是有的时候吃的时候就觉得这个呼吸就不通畅，有的时候上气不接下气，或者是说吞咽的时候就有痛苦的那种感觉，如果是自己都不怎么会吃了，或者是不怎么会喝了，而且开始发生体重开始下降，这些都是非常重要的，马上要找医生做这个吞咽评估。
Okay, and that is the end of my presentation. I don't know if anyone has any questions.
现在他的讲座